Hi, so let's talk about the role of menstrual poverty on the rate of HIV transmission. First of all, menstrual poverty is the inability of a woman or a girl to afford menstrual products, education on menstrual management and hygiene, and menstrual facilities. So, menstrual poverty play a significant role in the rate of HIV transmission, especially in underdeveloped countries. Let's just consider three ways in which menstrual hygiene or menstrual poverty contribute to the rate of HIV transmission. First of all, we should talk about transactional sex. We all know that transactional sex is exchange of sex for money or exchange of sex for something. So because a woman cannot afford sanitary pad or a girl child cannot afford sanitary pad, she will end up transacting her body, sometime unprotected, like unprotected sex with a man that is possibly exposed to HIV or someone that is infected with HIV, and that will lead to another transmission. Another way is biological risks. So biological risk is when a woman uses unhygienic materials such as cotton wool, rags, tissue paper, and the rest of it to pad up herself during menses. And this unhygienic material can lead to inflammation of the urinary tract, leaving a wound in the urinary tract, which will now serve as a point of entry for HIV transmission. And also, research shows that for people that are already living with HIV, viral load in the genital tract can increase during menstruation, potentially making transmission more likely if proper sanitation is not maintained. So that means during menstruation, viral load that are around the urinary tract replicate. So if proper hygiene is not observed during menses, the risk of transmission will increase. Another one is education dropout. We have list three. One, transactional sex. Two, biological risks. And the last one, education dropout. So menstrual poverty actually causes some women or girls to miss school or suddenly drop out. And this school dropout can lead to lower level of education on HIV prevention, because of course they are not in school. They will not learn on how the various ways they can prevent themselves from infecting HIV. Without this education without education on sexual health and safety, girls are less likely to know how to prevent themselves from HIV. So finally, the stigma and embarrassment associated with poor menstrual hygiene can prevent a whole lot of women from accessing health service, including HIV testing and treatment, because of the stigma associated with poor menstrual management. It restricts a whole lot of women from accessing care, and this care can also include HIV testing and ways that they can prevent themselves from infection or getting another person infected. So, for us to reduce the rate of HIV transmission among women and girls, we must first of all address period poverty, which include providing sustainable menstrual material and infrastructure. Thank you.